Hello and welcome to the sixth video in our series of 6 on job analysis. My name is Ginny Marshall and I'm the president of DSI Work Solutions. We are very pleased to be able to bring you this information and thank you for joining us. Today we are going to focus on how the results of a job analysis, when well documented in a format such as the job function-based description, can be a tremendous aid when it comes to return to work for an employee after an injury or an illness has sidelined them. In an earlier video, we did focus a bit on how you can use the job function-based documentation to assist with interpreting restrictions. The ability to identify those restrictions and compare them to the physical requirements of each job function demand is what makes the understanding of what the individual employee can do much clearer to all of the stakeholders who have a need to know: the employee, the supervisor, safety personnel, human resource personnel, and perhaps others. Let's go a little bit further and explore how various healthcare providers can use this description to facilitate return to work. I want to re-emphasize the importance of the job function description as a communication tool. If this information is provided to the healthcare team, it will foster more objective and succinct communication about what it is that a healthcare provider's patient needs to do at work. The importance of this is to realize that when there is an absence of objective, reliable information, healthcare providers must be conservative. That is why we see restrictions that seemingly make it impossible to have an employee do work activities of any meaningful use. As we are able to communicate better to the healthcare practitioner what it is the individual must do, many of their concerns can be alleviated, and then they can be more communicative in indicating which job functions are safe in their professional opinion and which ones should be avoided. And also, as they are meeting with their patient, they can be sure that their communication is clear. And then when the patient returns to work with work level recommendations or restrictions, the communication about what is safe and what should be avoided is much easier using the language that has been written into the job function description. The job function description can also help with therapeutic intervention. Because the work is described well in terms of the functional base as well as the physical demands base, it makes it possible for rehab professionals to develop some of their treatment goals around the concepts of what the individual must do at work. It lays a basis for communication for them too, in order to communicate how their patient, the employee, is progressing towards return to work. Without this information, it is simply addressed subjectively, if it indeed is addressed at all. And that is not the fault of the rehabilitation specialist. It is a situation that is present due to the lack of trustworthy or objective information relative to work. As an example, let's look again at our grocery stocker example. In function number 2, we can readily see that push-pull strength is vital to being able to handle the carts and dollies. With this information, the rehab specialist can incorporate push-pull strength activities into their plan of care and be addressing it as soon as it is practical and appropriate to do so. Without this information, push-pull strength may not be addressed at all during the course of care. And often, as has been the case historically, this is not addressed until the individual has been discharged from their rehab program, has failed to return to work, and then is admitted into a work conditioning or a work hardening program. Hopefully what you can see is that providing this information or having this information early on can make sure that it is very expediently addressed that which needs to be accomplished for this patient to return to work safely, efficiently, and productively. Another way the job function description can be used is in the area of job coaching. When an employee has been absent from their job for an extended period of time, fear of return to work can play a significant role, especially if the individual is returning to the activities that they associate with the injury or the problem to begin with. The job function description can be used as a guide to walk through the job when the individual returns in order to preemptively identify any issues or concerns and to help the individual feel confident that they are ready to resume work activity. This walkthrough can be done with a supervisor, a safety professional, perhaps a trainer, or even an outside professional, such as a physical therapist, an occupational therapist, an athletic trainer, or others. This individual could participate in a physical demands test that is based in the information provided in the job function description and is very similar to the work activity that they are used to performing. When testing is similar to the job, it increases the confidence of the individual that they are ready to return to work. We are going to explore this in more detail in the next series that we will be bringing to you, where we focus on job function-based physical demands testing and the myriad of ways that you can use it to help a workforce be safe, stable, and productive through their relationship with an employer from the point of hire to the point of exit. If you want to learn more about conducting job analysis, developing these job function descriptions, creating an ergonomic opportunity report, and even designing and delivering function-based testing, please visit our website, dsiworksolutions.net, where you can delve in deeper and learn more about these courses that we offer to you. You can even take the first lesson in any of the courses with no obligation. We hope you've had some great takeaways from this series on job analysis. Thank you for attending. Stay safe, and we'll see you again.